Hello. How to differentiate evening and osteomyelitis by biopsy? So, पुरानी बात है. I was age 6 and we used to stay in a place called as Gwalior, Madhya Pradesh. And I used to go every day with my dad for a walk there in a market called as Bada. Bada Jan hai Gwalior, right? And as I used to go there and I used to walk there, so I used to walk like a king on the street. तैयार होके जाता था. And there used to be a very wonderful balloon seller there who used to sell balloons which were like blue colored, fish shaped balloon, and then heart shaped, red colored balloon. My father used to work in Morena, Daramon. So then, I used to love balloons before I finally became one balloon myself. And then I used to ask my dad, मुझे वो balloon खरीद के दो, मुझे वो balloon खरीद के दो, मुझे वो balloon खरीद के दो. But they were very costly, and the total of 2 balloons per day is and you multiply by 30, 31 used to be more than my dad's income. But 6 साल के बच्चे को समझ नहीं आता. So I used to tell him मुझको लेके दो. And then there used to be a fight. There used to be a fight between me and my dad, and I used to throw away my clothes. I used to roll in the mud, eat the mud, pull the clothes of the balloon seller. And finally, after a fight of 15, 20 minutes, I was mud clad. My clothes were in the hand of my dad, and in my right hand, I used to have a blue colored fish shaped balloon. And in my left, I used to have a heart shaped red colored balloon. And I used to walk on the street. And it used to be beautiful. When I used to reach home, my mother will scrub me, but I will not open the fist because that was right. That was the victory, the sign of my fight and the victory. And then I'll sleep. We used to sleep in one room, grandparents on the bed, and we used to sleep on the ground all around them. And it was lovely. It was rich childhood. Money nahi tha, but प्यार बहुत था. And then I will keep on looking at the balloons in the sky till the time I'll doze off. And in the morning when I'll get up, my grandmother will pick me up and place on her lap and say, "So what was it that you learned yesterday?" I said, आपके बेटे की फिर से मैंने ऐसी की तैसी कर दी इन द मार्केट. आई यूज्ड टू बी वेरी वेरी proud about it. And then she used to tell me, look, as you will grow in life, the balloons will keep on changing. It might be a cricket tournament you wish to win. It might be a seat in a medical college or post graduation. It might be a hospital you want to build. It might be the girl you wish to marry. But अगर आपको पता है कि आपको क्या चाहिए और अगर आपको इससे कोई फर्क नहीं पड़ता, यू आर नॉट अफेक्टेड बाय व्हाट द वर्ल्ड थिंक्स अबाउट यू, तो किसी के बाप में दम नहीं है, आपके बाप में भी दम नहीं है या आपको वो ना मिले. सो दिस इज व्हाट इज वेरी इंपॉर्टेंट. एंड इसीलिए टुनाइट व्हेन यू स्लीप, राइट, write down your dreams. It's important to write down your dreams. You need to spell them, you need to smell them, you need to remember them. क्योंकि सपना वो नहीं होता जो नींद में आता है, सपना वो होता है जो नींद उड़ा देता है. Right? So this is what is very important. So your balloons, you write down, right? And write down detail of it. Write down every bit of it that you wish. So let's go to the next section. We are done with the first section. We are going to the next section that talks about infections. And remember, the king of infection is Staphylococcus aureus, and it comes to the blood. It's hematogenous. Because it comes to the blood, so it goes the most vascular part, the metaphysis. Okay. There are some exceptions where you will choose other organisms, like sickle cell anemia. You have salmonella as an infective organism, and it's in the diaphysis. Right? IV drug abusers and foot injuries. On page number 84, you have to write down at the bottom. Pseudomonas. Open injuries, staph aureus. Human bites, the most dangerous bites, Eikenella. Animal bites, Pasteurella. And also in your flowchart, it's written like this: sickle cell anemia, overall, Salmo, Meta, Staph aureus, Dia. अगर मेंशन नहीं है तो सैल्मोनेला. डायाफाइजिस मेंशन है तो सैल्मोनेला. बट अगर मेटाफाइजिस मेंशन है तो स्टैफ. Yeah. So we'll talk about what is multifocal osteomyelitis. Salmonella can involve multiple bones. But answer is Cepho syndrome, which means synovitis, acne, pustulosis, hyperostosis, osteitis. Okay, so this is Cepho syndrome. It's given to you on page number 87, top right. And it is HLA-B27 positive. It's an autoimmune disorder. It's a misnomer, all right? So sickle cell and salmonella can involve, but Cepho is, H is hyperostosis. Hyperostosis. So basically, when they ask you multifocal osteomyelitis is, so you have to let go the word osteomyelitis. And if Cepho syndrome, which is an autoimmune disorder HLA-B27 positive, should come to your brain. Cepho means synovitis, acne, pustulosis, hyperostosis, osteitis. Since it's an autoimmune disorder, the disease will be treated just the same way, autoimmune disorders. Sickle cell anemia and salmonella, which is part of it, can involve multifocal osteomyelitis. But if both the options are there, Cepho and salmonella or sickle cell, you will choose Cepho syndrome. Okay, Pratiksha? Pratishtha, are you good? It's not osteomyelitis. It's an autoimmune disorder. Osteitis, synovitis, hyperostosis. Yeah, in multiple answer, it will be ABC. A, B, and D. Not A, B, and C, A, B, and D. So, multifocal osteomyelitis is Cepho syndrome. Synovitis, acne, pustulosis, hyperostosis, osteitis, which is an autoimmune disorder. Okay, page number 87 on the top right, you can fill in the blanks. Okay, we'll again see the slide of it. So when you look at the lower limb, Faber, that is flexion, thalassemia is not the answer. So flexion, abduction, externalization, Faber. In the lower limb means there are more things in the joint. There can be more fluid, more synovium, more pus, and opposite of it, flexion, adduction, introduction. That is flexion, adduction, introduction. Father, it's a position in which the content of the joints are reduced. So remember that Faber, since it has abduction, there will be lengthening. Farther, there will be shortening. So Faber is seen when there is synovial proliferation, any cause, when there is pus in the joint, infection, like septic arthritis. Septic means joint, the pus in the joint. Arthritis is a misnomer. It doesn't mean that cartilage will be destroyed. If you will not treat septic arthritis properly, arthritis word means cartilage gone. Then the cartilage will be destroyed. But in septic arthritis, it just means pus in the joint. पुराने जमाने का वर्ड है, चले आ रहा है. There's a band that starts from ilium, crosses the hip, crosses the knee, and goes to tibia. When there is a contraction of the muscle, there is relaxation. Sudden contraction is spasm. Permanent short. So iliotibial band contracture is seen in a disease called as polio. And then you have anterior dislocation of the hip. Why it is number 4? Because it is the rarest. Then you have Fadir, posterior dislocation, followed by arthritis is the cause. Remember, hip dislocates posteriorly, that's why Fadir number 1 cause. Fill in the blank, please. Okay, so in Faber, the length of the limb will be longer because there is abduction. In Fadir, right, there is shortening. Are we good? Why osteomyelitis occurs in metaphysis? You can see a box, pink box just above osteomyelitis metaphysis. Because at the metaphysis, you have less monocyte macrophage system, very vascular area. The vessels, they take a turn here. When they take a turn, the speed of the blood decreases. So there is more contact time for the bacilli to dislodge from the blood. And trauma means blood around. And blood is culture media for organisms. So these are the causes why osteomyelitis is very common in the metaphysis. Depleted monocyte macrophage system, high vascularity, hairpin loop system, and multiple microhemorrhages or hemorrhages around for the organisms to be cultured there. Osteomyelitis is in the metaphysis. Going further, most common bone to undergo osteomyelitis is lower end femur. In adults is the vertebral body. And the most common joint to get infected is knee because lower end femur is the site from where the infection will jump into joint. That's how you should remember. So lower end femur is a very, very common area. If you don't know which bone to choose femur, you'll be happy. If you don't know which joint to mark knee, you'll be happy. So osteomyelitis involves the lower end femur. In adults, it involves the vertebral body. And knee is the most common joint in which sepsis of the knee occurs. So if you look at this, reduced movement of a limb, toxic child, somebody not eating, not sleeping, and tender metaphysis is a clinical diagnosis of osteomyelitis. Osteomyelitis in the first 24 hours, X-rays are normal. MRI will show you changes in 12 hours, bone scan in 12 to 24 hours. Treatment is start antibiotics, give to control staph aureus. So in first 24 hours, usually it's non-operative. Osteomyelitis more than 24 hours, X-ray will have loss of soft tissue planes. MRI will show you marrow changes. Bone scan will have increased activity. Here treatment is surgical. Whether you operate or you don't operate, antibiotics are given for 6 weeks and you should make sure they cover staph aureus. In short, MRI and bone scan can show you changes earlier, but if it has come into the X-ray, that is loss of soft tissue plane, you need to operate. So a simple X-ray can tell you when to operate, when not to operate. It's very, very important for you to remember. Do you understand this? So in osteomyelitis, first 24 hours, non-operative option does exist. Going to the septic arthritis, 1-month-old child presents to the emergency with immobile joint and swelling on the left thigh. ASR raised in child, toxic, X-ray, soft tissue enlargement. Which of the following can be diagnosis? We're talking about osteomyelitis, okay? Staph aureus. Now next. In a joint, things are very aggressive because there's a cartilage, which is a very sensitive structure, cannot be repaired so easily. In the joint, if there's a fiber at the hip, flexion, abduction, external of the hip, and the child is 0 to 5 years, toxic, that is, there is fever, there is high ESR, there is high CRP, absent movement of a joint, you think of septic arthritis. So here you have something called as a Kocher's criteria. Kocher's criteria has different things. So it is fever, TLC, total leukocyte count, ESR, and one clinical point, weight bearing, whether you can do it or not. You total these 4 points, right? So fever, TLC, ESR, and total, and you can find out the diagnosis of septic arthritis. So septic arthritis, again, the organism is Staph aureus. Order of investigation is X-ray, MRI, aspiration. But here, if you are suspecting septic arthritis, you are suspecting, even if you're suspecting, your answer is going to be surgery. So here, non-operative matlab hi nahi hai septic mein, because the cartilage is going to get destroyed within very, very early time. So you have to be very aggressive. Septic arthritis of a joint is an emergency. All right. And whether you're dealing with joint infection or bone infection, duration of antibiotic is going to be 6 weeks. Whereas if age group is 6 to 12 years, non-toxic child, decreased movement, it's a temporary proliferation of synovium, transient synovitis. Here, again, because fever है ना, movement destroyed है, so you can't figure it out. So you will X-ray, MRI, aspiration. Treatment is rest because transient है, will go away, transient. But होगा क्या? Fever होगा, remember fever. So this is very, very important. So going to this, septic arthritis versus transient synovitis, remember fever दोनों में है. 0 to 5 years is sepsis, 6 to 12 is transient, sir, and movements in septic arthritis, absent movement, and in transient synovitis, it is decreased movement. Weight bearing, beta. Fourth point is weight bearing, whether you're able to stand on the limb or not. Okay, weight bearing is the point. This is femur epiphysis. Tom Smith arthritis is septic arthritis of hip in infants. Right? The femur epiphysis is totally destroyed. So one part of the joint is destroyed, leading on to hypermobility. That is why normally septic arthritis should have absent movement. But here the joint का part ही नहीं है, तो hypermobility हो जाएगी. Sir, initially absent movement तो होगा, true. But Tom Smith is called only when the total destruction occurs. Okay? Okay. Are we good? Tell me. Done. Answer. Widening of joint space is there. True. फॉल्स नहीं है, ट्रू है. बिकॉज फेबर होगा, एक्सरे पे ज्यादा जगह लगती है. ट्रू. फॉल्स. यू ऑपरेट सेप्टिक, यू ऑपरेट, यू डोंट वेट. ट्रू. फॉल्स. बिकॉज देर इज फेबर. In fact, third, if you wait, all right, within 3 hours the joint is gone. Are we good? Yeah. Tell me the answer. Answer. It's wrong. Answer is periostal reaction, day 7 to day 10. बोनी चेंज पूछता है बेटे. ए नहीं होगा. बूम. बूम का मतलब होता है दिन दिहाड़े ले गए आपसे, आपकी आंखों के नीचे से. आंसर डी. राइट. नेक्स्ट. ओके. दर्शन. लॉस ऑफ सॉफ्ट टिश्यू प्लेन 24 आवर्स के बाद होता है, और वो सॉफ्ट टिश्यू चेंज है. यहां पूछा है बोनी चेंज. आंसर एस्पिरेशन. करेक्ट. फ्लूइड. Fluid is the best way to diagnose it. Brilliant. Capital epiphysis, femur. Now we are done with acute osteomyelitis. Now let's move to the subacute osteomyelitis. So we are on page number 86. Brody's abscess. So Brody's abscess is subacute osteomyelitis. Only one textbook mentions it to be chronic. And once there was a question when subacute osteomyelitis was not an option, so we had to choose chronic. So it's a rare chronic, but it's going to be subacute. It is seen in upper end of tibia. Lower end tibia का भी इमेज दिखाया हुआ है. ऑलराइट. एंड देन द बेटा एक्सरे मान्य हमेशा इसलिए करते हैं किसी भी केस में. ट्रॉमा, इन्फेक्शन, ट्यूमर सबको हम क्लिनिकली पहले डिफरेंशिएट करेंगे किस कैटेगरी में. देन वी विल गो फॉर द नेक्स्ट इन्वेस्टिगेशन. सो इट इज द फर्स्ट इन्वेस्टिगेशन ऑलवेज इन ऑर्थोपेडिक्स. ओके. So it has lytic lesion with sclerotic margin. Sclerotic margin means that the patient's immunity is very competent. Immunocompetent host. It means that Brody's is not seen in HIV. इम्यूनोकॉम्प्रोमाइज में नहीं होगा. ओके, ये पता होना बहुत जरूरी है. आर वी गुड? As the infections progress, they will isolate a piece of bone inside a cavity and make it dead. It's called as sequestrum. So इसका आंसर बता दो. Brody's, right? Yeah. So in a cavity, if you have an isolated dead bone, that's called as sequestrum. The surrounding live bone is called as involucrum. And the draining sinuses which comes to the surface of the bone are called as cloacae. Yeah, Brody's can be at lower end of tibia also. Photo भी दी हुई है आपको मैंने image. Page number 86 में you have a photo on the green box. Right? So you have a dead bone. Sequestrum in English dictionary means dead and isolated in a cavity, surrounded by a live bone called as involucrum. And then there's a draining sinuses called as cloacae. If you have Deepika, you want me to explain transient synovitis wala question, beta? ये वाला? There is very simple rule, beta. In transient synovitis of the hip joint, you have Faber. Flexion, abduction, externation. Here it's mentioned it's adduction, internation. So that's not true. May follow any other infection, true, transient, cross reaction. ESR and counts may be high, true. Ultrasound may show Faber. Okay. Yeah. So if you do not treat chronic osteomyelitis on time, it can lead to chronic discharging sinuses, causing a malignancy. What is the malignancy of chronic sinuses? Very good. Squamous cell carcinoma. Or it can lead to chronic infections or myeloidosis. Okay, so this is something which is a complication of chronic osteomyelitis. So if you look at the x-rays, you will see there is a dead bone in the center surrounded by the live bone and draining sinuses. So this is sequestrum in the center, live bone surrounding it, draining sinuses. Similarly, you can see here, sequestrum in the center, live bone surrounding it, draining sinuses. So that's how the images come. So the lower end femur is the commonest site for chronic osteomyelitis. So acute and chronic, whatever is acute will turn into chronic. So lower end femur is the commonest site. For acute osteomyelitis or chronic osteomyelitis. Remember this, okay? Right? So lower end femur, deformed bone दिखेगी आपको. Dead bone in the center, surrounded by involucrum and draining sinuses. Complications are amyloidosis and malignancies. A child presents with fever and discharging pus from right thigh following the X-ray. Identify the labeled structure. What will you label it as? Good. You're labeling it as involucrum. So this works. This way works for you. You read a topic and you solve the question. Is that okay? Lower end femur is the commonest site for acute osteomyelitis and chronic osteomyelitis both. Anuj. Again the same thing. Deformed lower end femur. Chronic osteomyelitis. Brilliant. Next. Again the same thing. That's one of the commonest images to come in infections is chronic osteomyelitis. So dead bone is white, it's all white. Remember that. Ring sequestrum is associated with the following. So if you look at page number 87, I have given you a list of sequestrums, lot of sequestrum. So remember that the only one you need to remember is the ring sequestrum for amputation, stum and pins, the external fixator. So there's a table. This is one table you can go through before your exam. I cannot remember it. I have given it to you for completion, but if I only need to remember one, ring sequestrum is something I will remember for my life, all right, for the amputation stumps and for the external fixators. बस इतना बहुत है. देखो मैं एक चीज बहुत आपको क्लियर करना चाहता हूँ. There is, yeah, sinuses, draining sinuses are the cloacae, correct. All right, एक चीज मैं आपको क्लियर करना चाहता हूँ कि that you cannot do all the sequestrum, you can't. So why to trouble yourself too much? But एक बार नजर मार के जरूर जाना है. Which slide do you want, Anshul? None? Answer? Again, answer is not TB, it's Staph aureus. So in osteomyelitis, anywhere in the world, the most common, even in spine, wherever it is, जाग रहे हो, सो रहे हो, आता है नहीं आता, जिंदा हो, दुनिया छोड़ के जा रहे हो, माँ के की करना Staph aureus. All right, कुछ और नहीं सोचना. So this is deformed sclerosed bone. What is it? This is osteomyelitis, right? Which one do you want me to choose? This one? You can see it. It's marked on the boundary, not inside. Okay, so it's on the boundary, it's not inside. So that's involucrum. Next. Okay. Vedika, what happens on what day in osteomyelitis? On imaging, first 24 hours, only MRI and bone scan will have changes. More than 24 hours, the X-rays will have loss of soft tissue planes. Day 7 to day 10, periosteal reaction will come, beta. Now it's not about time. If the dead bone comes, it's chronic osteomyelitis. It has got nothing to do with time now. Okay. If the earliest change, irrespective of bony or soft tissue, and if they mention X-rays, loss of soft tissue plane, Prachi. So any notes you will have about sequestrum. Just remember ring sequestrum seen in amputation, stumps, and Steinman pins. Okay. And even if you don't have, the notes will be uploaded, beta. And in those uploaded notes, right, you can see the sequestrum layers, the types of sequestrum. Which is the 12th question, beta? How do I know which is the 12th question? I haven't numbered the questions. Brody's abscess. Yeah, tell me. बोलो रोशनी जी. हाँ, इट्स गिवन लोअर एंड. मैंने आपको बोला है कि लोअर एंड अपर एंड दोनों होता है. आप देखिए बेटा, मैंने आपको इमेजेस भी दे रखी हैं उसकी. सर sequestrum is not a periosteal reaction, it's a dead bone. Involucrum is the boundary that forms the cavity in a dead bone. They are not periostal reactions. Periostal reactions पहले चैप्टर में खत्म कर दिया हमने. Solid periostal reaction, thick, thin, irregular. Okay. So this is all dead bone. This is again sequestrum. This is involucrum. Upper end of humerus. When you get an MRI done of the chronic osteomyelitis, you will see a rim sign that is surrounding the dead bone seen on MRI in osteomyelitis. So rim sign is seen on MRI in osteomyelitis. Okay, rim sign is seen on MRI in osteomyelitis. This is important. Then there is something called as a segment of osteomyelitis, like in mandible or tibia. This is a variety of chronic osteomyelitis. So long segment. Sometimes they show you femur, tibia, anywhere. So Gary's sclerosing osteomyelitis. It means wide, thick band of the bone. All right, Gary's osteomyelitis. So when you are treating osteomyelitis, now let's come to the main thing. Remove the sequestrum. सबसे पहले ये रख लो बेटा अपने notes में. Gary's osteomyelitis. It's a variety of chronic osteomyelitis. Right? Seen in mandible and tibia. When you're treating osteomyelitis, remove the sequestrum. So you can't keep on removing the sequestrum. No, you will keep on removing the sequestrum, तो bone टूट जाएगी. So you should know where to stop. Where to stop? Sequestrum is a dead bone. Dead bone does not have blood supply. So you need to stop where? Where it starts bleeding, called as paprika sign. What instrument is this? Nibbler. This is bone nibbler. They ask you this. This is bone cutter. This is paprika sign. Bleeding points means proper sequestrum has been removed. Now, after that, control the infection. Most important. Fill the gap. Either you will do it with a bone graft, which is usually taken out in human beings from the iliac crest, or bone cement. Polymethyl meth acrylate. All right, polymethyl methacrylate. So this is bone cement. So you fill the gap, because if you leave a gap, it will fracture. You need to fill the gap and then provide a good soft tissue coverage. How? By negative pressure wound therapy. It's also called as VAC, vacuum assisted closure. You need to understand one thing, beta. Whatever is, in human bodies, whatever is white in color, it has to be covered. So cover the white structures. Brain is white. Spinal cord is white. Cover करना है. Bone is white. Cartilage is white. Tendons are white. Veins are white. Arteries are white. वो रंग अलग भरते हैं, but they are all white. So you need to cover them. That's why you need to provide a good soft tissue coverage. Otherwise, they will desiccate and die. So if you don't cover these structures, they will desiccate and die. So it's very, very important to cover it. Okay. So when you look at these images here, right? This is negative pressure wound therapy. They have asked you this image. Vacuum assisted closure. So what you do is you remove the dead bone, do a proper control of infection. So you treat osteomyelitis, remove the dead bone, make sure there's no malignancy. Cover it and connect it to a machine which is giving you negative pressure. Suction pressure is in negative, -75 to -125 millimeters of mercury. It can be continuous or it can be intermittent. All right. And then it gives a good granulation tissue. That is why every white structure in human body should be covered, Prashant. Whenever you have any exposed tissue, brain ho, spinal cord ho, ligaments ho, tendons ho, vein ho, nerve ho, artery ho, cartilage ho, bone ho, they are all white. They should all be covered with the soft tissues. Otherwise, they will dry and desiccate. And what are covering structures? The muscle and the skin. They should be covered with the muscle and the skin. Okay, so this is very, very important. So it can be continuous or intermittent, and it gives a good granulation tissue. Malignancy is contraindicated because it's enhancing the new cell formation. Okay, so it will enhance it. That's why. By negative pressures, you stimulate the cell formation, the granulation tissue. So in malignancy spread हो जाएगा, बढ़ जाएगा. Rim sign is just meaning that in osteomyelitis you have a MRI sign. You don't need to know further. You just need to know in chronic osteomyelitis it's on MRI. That's it. The rim sign. You just need to know the name bit. Okay, Prachi, just the name. Right. Paprika sign during debridement is crucial in management of which of the following condition? Chronic osteomyelitis. Thank you very much. Next. So the answer here is B choice. Pressure is 30. Can't be positive, right? It is a negative pressure, so it has to be positive, right? That's wrong answer. Okay, next. This is Garay's picture. Although I told you it's in mandible and tibia, but can be anywhere. Sclerosed long segment. How do you eschar means dead necrotic tissue, beta? This question? देखो. What is used for coverage? Skin and muscles are used for coverage of any tissue, beta. Yeah, eschar is necrotic tissue is a contraindication, beta. ये लिखा. So then you have a theoretical topic, osteomyelitis in newborn. Again comes to blood. Can involve multiple bones. Staph aureus infection. Paucity of clinical sign. Anybody who can tell me when will you have fever or signs of inflammation? When you have immunity, right? So when a newborn is there, it's already less immunity. So clinical signs are not there. All right, and that's why it's poor prognosis. Okay. So clinical signs indicate good immunity. If it's not there, it means poor prognosis. Okay. Multifocal osteomyelitis, we have already done that. For those who missed out, can write down in a flash. Non-steroidal anti-inflammatory drug, steroids, and disease-modifying anti-rheumatoid drugs are used. Paucity means come. It's not there. Paucity मतलब कम होता है बेटा. Paucity of water means water कम है. Paucity of difficult questions means difficult questions कम आए हैं. Okay, paucity. Done? when you look at infections of hand, paronychia is the most common infection of hand, infects the nail bed. Phelon or Whitlow is infection of the pulp space of fingers. Infections of the pulp space. That's Phelon or Whitlow. So they are usually seen in the thumb. And when you need to operate, like this is the area, right? So you will always operate by vertical incision so that you can close it, open it everywhere. You will never do it by a horizontal fish mouth incision. Not allowed. Because you will not be able to open the space. And then, if you don't treat it properly, it can lead to infections of the bone or the tendon sheaths. So there are a lot of tendons going till the end. They're getting infected. So osteomyelitis more than tenosynovitis, right, is a complication. It's a complication which can occur. Done. Paronychia. It's an infection of the nail bed. It is the most common infection of hand. And you need to take out a piece of triangular piece of nail to remove the pus sometimes. You need to do removal of the nail bed to drain the pus. Okay, so paronychia. Phelon or paronychia organisms? Staph aureus, always. Done? Yeah. Infectious synovitis is infection of the flexor tendon sheath of finger. So there is 4 signs here. Flexor sheath जब infect होगी, they will have flexion of the finger. And if you try to extend it, it's painful. Because it's infected, uniformly swollen. And when you will tap on the finger, there will be tenderness. These are called as cannibal signs. All right. So cannibal sign, the most specific is tenderness. So it's tapping on it, and that's tenderness. Very, very specific sign. All right. Infectious synovitis, cannibal sign. Right. Remember one thing. Then there's the radial bursa. That's along the thumb. Ulnar bursa. That goes to the little finger. In between the two, there's a communication called as forearm space of Parona. So if there's any infection in the thumb, it can go here through the forearm space of Parona, go to the little finger. All right. So infections of the thumb can go till the little finger. True? Now, the index finger tendons, along with their first lumbricals, they are in a thenar space. Thenar space does not have anything to do with the thumb. It is the first lumbrical, and it's a separate space. That's where the thumb infections can't go to the index finger. Communication nahi hai. And the mid palmar space has all other lumbricals and all other tendon sheaths. So second, third, and fourth lumbrical are in the mid palmar space. All right. So this is very, very important. Remember, lumbricals, they make MCP joint flexion and extension of joint. Make a L in your hand. L. ऐसे बोलो took. That's the action lumbrical. बोलो took. Action Lumbricals, the first two lumbricals are supplied by the median nerve. The other two are supplied by the ulnar nerve, right? Bolo, tuk, that's the action of lumbricals. When they are paralyzed, tum, there is hyperextension of metacarpophalangeal joint and flexion of interphalangeal joint. Claw is claw hand, tuk, tum, tuk, tum, tuk, tum. So this is something you should remember. Claw hand, right? Ulnar claw hand, or median claw hand, or ulnar claw hand, depending on which particular nerve is gone. So remember, thenar space has index finger tendon and only first lumbrical. The mid palmar space has all other three lumbricals. The infections of the thumb can go to the forearm space of Parna to the little finger, but cannot go to the index finger because the index finger is separate in the thenar space. Are we good? Remember this. चलें आगे? Can I go ahead now? Right. Thank you. Answer. C. Mycetoma. It is infections involving the subcutaneous tissue. लो लास्ट क्वेश्चन ले लो. What beta? सर्वोत्तम what? How what? Through the forearm space of Parona. बेटा ये बताया तो यहाँ पे. God bless everybody in this world. It's a beautiful world. All right. Mycetoma is chronic progressive infection of subcutaneous tissue. If it is bacterial, actinomycetoma is rapid and fungal is slow grumbling. It involves all structures except the nerves and the tendons. They have a triad: tumor-like painless swelling, discharging granules, and sinuses. So this is what they have. Painless, okay? In orthopedics, the most common symptom is pain. If there is something painless, you should remember, okay? Actinomycetoma is bacterial. Eumycetoma is fungal cause. What does this mean? AMMF? So actinomycetoma, actino. Bacterial cause occurs in the mandible. If there's a question, multiple discharging sinuses around the angle of jaw, that's actinomycetoma, bacterial cause. And MF means Madura foot. Madura foot. So above the waist, bacterial causes. Below the waist, fungal causes. That's the rule. Above the waist, bacterial causes. Below the waist, fungal causes. If you remember this, you'll be good. Dr. O'Neill, brilliant. Actinomycetoma is a bacterial cause. Angle of jaw. Mandible में होगा. Discharging sinuses. On MRI in mycetoma, dot in the circle sign is seen. All right, so we are done with this. Now we talk about the national disease, tuberculosis. Tuberculosis of bone and joint, right, is usually through the blood. and it is difficult to isolate the bacilli, so it's called as paucibacillary. The most common site is the lung, followed by lymph nodes. Since lung se aayega, ऊपर से नीचे जाएगा SHK, spine, called as spot spine, the man who described it. Then the hip, then the knee. SRK, Shahrukh Khan, SHK, spine, hip, knee. Tuberculosis of the shoulder is dry. It's called as TB shoulder. And spina ventosa is tuberculosis of fingers. It is the only TB that can have periosteal reactions. In tuberculosis, periosteal reactions are not there. This is the only TB which can have periosteal reactions. Otherwise, it cannot be. Pott's spine means TB. Pott's spine means TB spine. Even Cox means Pott's, means TB, Cox. Dry means no fluid, no effusion. Dry means no effusion. स्पाइना वेंटोसा, ट्यूबरक्लोसिस में ना पेरियोस्टल रिएक्शन नहीं होता. पेरियोस्टल रिएक्शन स्टैफ ऑरियस करेगा. बट जब ट्यूबरक्लोसिस फिंगर्स को इन्वॉल्व करता है तो पेरियोस्टल रिएक्शन कैन बी देयर. Okay? You know, tuberculosis, what is it? It's single. Dry means there is no effusion, no fluid in the joint. Normally TB will have fluid. Dry means कुछ नहीं होगा. Dry होगा, बिल्कुल joint destroy हो जाएगा. There will be no fluid in the joint. Infections, they cause inflammation, fluids. Tuberculosis of the shoulder is quiet, dry. The two vertebra and the disc. Vertebra, vertebra, disc. Lower half of upper vertebra, the disc and the upper half of lower vertebra, they arise from the same mesodermal somite. So they have the same segmental artery. When the TB bacillus comes, it will involve one particular somite. Correct. Dry means non-exudative, right? This is called as paradiscal, means two vertebra involvement. So tuberculosis will not have single vertebra involvement. It's always two vertebra, one vertebra above, one vertebra below involvement. So TB is a two vertebral disease. Okay. Now, when you look at carefully, here comes the spinal cord, right? So it's an anterior disease. TB is an anterior disease. आगे होता है. Okay. If you look at the spinal cord, TB is anterior disease. Pus. Okay. So ये exudative है, fluid है, shoulder में dry होगा. Okay. Tuberculosis is paradiscal, means on both sides of disc. The rarest TB involves the facet joints of the vertebra or the spinous process. If this is the vertebral body, that's what TB involves. Pedicles, lamina, spinous process are rare. Spinous is very rare. Rarest is facet joints. Okay. Okay, done. So TB spine or Pott's spine is two vertebral disease, involves the vertebra and the disc, involves the bone and cartilage, is paradiscal, is anterior. Every vertebra has two eyes called as the pedicles and one nose called as the spinous process. That's a feature of every vertebra, right? Tuberculosis involves anti-elements. The Poshi elements and single vertebral disease is indicative of malignancy. Remember that. So अगर pedicle involve हो रहा है, spinous process involve हो रहा है, एक vertebra involve हो रहा है तो malignancy. Earliest X-ray change of TV spinous. The earliest is loss of curvature. वो दिया नहीं हुआ. So narrowing of this space. Loss of curvature was the best answer. It's not given here. So narrowing of the disc space. Okay. Answer. Spinous process. All right. Body the commonest है. So here you can see one pedicle. It's not there. So आंख मारता हुआ उल्लू means malignancy or Mets. And when both pedicle destroyed, blind bat sign. Previous slide, this one. Which of the following is a sign of metastasis? ऐसे पहचान लोगे बेटे? चेतन, ऐसे पहचान लोगे तो भी काम चल जाएगा. क्वेश्चन तो ऐसे ही आएगा. इतना बहुत है. टीबी इन वाइल्ड सोया सेप्सिस. अभी एक क्वेश्चन करेंगे ना, बात करेंगे हम लोग. सत्या, tuberculosis involves dorsolateral area means thoracic and lumbar area. The thoracic area, the lumbar area और thoracolumbar junction. तो मेनली डॉर्सोलंबर एरिया का होता है. एक भी एब्सेंट हो सकता है. बोथ एब्सेंट पेडिकल. It's called as a blind bat sign. Blind bat sign. Yes, they are only seen in malignancies. Dorsolumbar means thoracolumbar. True. Dorsal is thoracic. Lumbar. Dorsolumbar means. My question. What does dorsolumbar junction include? कौन कौन से vertebra होते हैं इसमें? D11, D12, L1. Okay. D11 लोग मार्क नहीं करते. So D11, D12, L1. तीन vertebra होते हैं बेटे. So there are three vertebrae that you should remember. Done. TB spine clinically pain. Earliest symptom. Earliest sign tenderness. Earliest neurological sign increased deep tendon reflexes. क्लोनस भी लिखते हैं कई बार एमसीक्यू में. क्लोनस इज ग्रेड 4 ऑफ अ रिफ्लेक्स. सिंपल डॉर्सल नंबर का मतलब है D1 से D12 प्लस L1 टू L5. Okay. Dorsal lumbar junction is only 3 vertebrae. So this we know. Increased deep tunnel reflexes. You on this slide, bete? Naruto. Right. Treatment of TB. Give anti-tubercular therapy, where the most important drug happens to be rifampicin. Yeah, earliest. Give rest to the part and surgery when indicated. So you have a flow chart here. The flow chart says that chronic pain, constitutional symptoms and night pain, TB, back pain, pot spine. Now, if you look in the box, first symptom is pain, first sign is tenderness, first neurological sign, increased DTR and clonus. What is DTR? Deep tendon reflexes. X-ray and MRI paradiscal lesion. Excuse me. Biopsy is the gold standard. Treatment is middle path regimen, which means you will operate when required, you will not operate when not required. Right? ATT, rest and surgery when indicated. Rest usually in TB is for first 3 to 4 weeks, not the entire course of ATT, because the ATT is minimum for 1 year. So here the rest is for usually 3 to 4 weeks. Now, if the patient has bowel bladder involvement on day 1, you operate. Bowel bladder involvement on day 1, you operate surgery. If in spite of your treatment, any point of time, patient has worsening, operate. And if patient is not improving, operate. Anytime bowel bladder involvement, sarvottam, operate. You can't wait. Okay? Now this is tuberculosis spine treatment. Worsening means, supposedly I had cervical spine TB, I had a wrist drop, I had some weakness in the wrist extension, and tomorrow it's gone. I have to operate. Neurological worsening. Right. So this is paradiscal lesion. You need to operate TB. In which direction will you go to operate TB? Will you go anteriorly, where the vertebral bodies are destroyed? Will you go posteriorly, where the spinous processes are intact? Will you go from the right side when there's vena cava? Or will you go from the left side when there's aorta? So we will go from anterior is out, very difficult. Posterior is out because disease has destroyed anteriorly. If you go posterior, total destruction. So now you have to choose between aorta and vena cava. All right. Aorta is a thick muscular vessel, safer to handle during surgeries, can be operated. Even if torn, can be repaired. Veins are papery thin vessels. Patient will bleed to death. So the answer is aorta. This is veins, not done. Can be sutured. All right. Surgeries के नाम दे रखे हैं. Decompression plus bone grafting. So you go either in the anterolateral direction or anterior. Both are almost the same. The result is fuse the bones so that at that time there is no further movement and pain to the patient. I am also waiting for 9 p.m. Answer. The only disadvantage of going at 9 p.m. is आप लोग नहीं साथ होंगे. Otherwise, it's so good. Tuberculosis cannot be a single vertebral disease. Okay. Next. Done. Paradiscal. Cool. Next. Somebody asked me this. Flexion deformity of the right hip. Evening rise of temperature. Weight loss. Backache. Hyperreflex on the knee. Iliopsoas abscess. 4 is the answer. That's iliopsoas. Cool. Indication for surgery in a patient with Pott's spine are all except. Doubtful diagnosis, yes, you want to have a biopsy. Cauda equina means lower limb weakness with bowel bladder involvement. So this is an indication. Drug-resistant TB is an indication to take out the samples. So answer is cold abscess without neurological involvement. Decompression surgery needed with progressive deficit in Pott's spine. Correct. Even after completion of ATD, there can be nerve abnormalities. Correct. Both are correct, but independently. They have no relation to each other. Okay. Next. If you have TB and if you're young, you will heal. Rule. If they catch it early and start treating, good. If it's active, means pus is there, good. Because medicines will work. They'll reach to the blood. If the neural deficit is gradually going on, good. And if on MRI spinal cord is normal, good. So these are good prognostic factors for TB spine. Okay. So that's how it is. Good are young, good. Rapid onset is bad. Active is good. So early onset weakness. Now that's you have to learn. Early onset weakness is a bad prognosis. Early disease is good. Early onset weakness and early disease is good. You catch it early. So spinal cord changes are bad. Okay. Active का मतलब होता है that you can still control with medicines. अगर TB is quiet, it means, and still there is a deficit, it means the spinal cord has got damage. Permanent changes have occurred. So early onset is good, but early onset weakness is not good. Very good, Veena. Thank you. When you have any disease, and it destroys your joint, your aim of treating it is to replace the joint, called as arthroplasty, joint replacement. But if because of any reason you cannot replace a joint, it's very unfortunate. But then you fuse a joint. That's called as arthrodesis. When you fuse a joint yourself, that's surgical fusion of a joint, right? Arthrodesis. A surgeon will expose the joint, remove the dead bone, remove the cartilage, expose the ends, fuse them together. So the fusion that the surgeon will do will be a surgical fusion. The surgical fusion is bony and painless. Because the surgeon has seen that the bony ends fuse and there's nothing, no disease left. For example, if you have to do hip fusion, there's a cobra plate that is available for hip arthrodesis. If the same work is done by a disease, it's called as ankylosis. Ankylosis is a disease doing a fusion. Problem is, it will not know where to fuse, it will not know how much to fuse. Ankylosis, when it's bony, bony means solid. S for solid, S for septic arthritis, S for spine TB, S for spondylitis, ankylosing spondylitis. That's bony ankylosis, painless. Whereas fibrous ankylosis is painful. Fibrous में F होता है, painful में F होता है. So TB spine is bony. TB everywhere else is fibrous. And fibrous में R होता है, so rheumatoid arthritis. So if you look beautifully, very, very easy to remember. In TB, spine, tell me which ankylosis will occur? Bony. Very good. TB hip, fibrous. Very nice. In cases of arthritis, in RA, what type of arthritis will be there? Fibrous. In ankylosing spondylitis, which will be the one? Bony ankylosis. Beautiful. Okay, please fill in the gap about the arthrodesis and ankylosis. Then I'll talk about arthroplasty, that is joint replacement. Ankylosing spondylitis में बेटा lower back एक होता है because of the muscles, not because of the bone movements. And we are talking about initial stages. The fusion पूरा हो जाता है, final there is no movement, there is no pain, it's over. Fuse हो जाता है व्यक्ति, उस एरिया पेन नहीं होगा, पूरा पूरा का पूरा फ्यूजन हो जाएगा. सेकंड, व्हेन यू आर लुकिंग अबाउट एंकाइलोसिस स्पॉन्डिलोसिस द बोनी फ्यूजन, अगर उसके अंदर कहीं पर भी फाइब्रस कंपोनेंट रह गया, then it can be painful. So majority of the fusion is bony, but there can be some fibrous component as well. Remembering is simple. B for bony, bony is solid. S for solid. S से सब कुछ है. Septic, spine, AS, S is all solid fusion, bony. Fibrous, so solid, bony is fusion is in the spine, so everywhere else is fibrous. Fibrous में R है तो R है, rheumatoid arthritis. Early stage, yes, it's because of enthesitis, but finally the ache goes away. It's only fused. Khatam. Are you done with this? Can I go ahead now? When you are replacing a joint, one way of replacing a joint is you remove the body parts, like hip ka femur ka head nikal diya. So the femoral head has gone out. Now that's an empty space called as excision arthroplasty. Long back, there was a procedure called as girdle stone excision arthroplasty for TB hip. It was a name. But then people realized you can't just take it out. You need to replace with something. So what did they do? They started replacing with femur, called as hemiarthroplasty. In hemiarthroplasty, you had two types of femur. One was the one which had holes, called as Austin Moore. Moore में भी दो O होते हैं. That's how it goes, Austin Moore. The second is without fenestrations, that is Thompson's. मैं exam देने गया, and I made a mnemonic. The one which has got holes is Austin Moore. पहला ऑप्शन था जिसमें दो ओ है, वो फेनेस्ट्रेटेड है. क्वेश्चन आया, नेम द प्रोस्थेसिस विच हैज होल्स. पहला ऑप्शन था थॉमसन. मैंने देखा थॉमसन में दो ओ है, मैंने आंसर मार्क कर दिया. मैंने बहुत सारे दोस्तों को ये बताया, उनका भी गलत हो गया. बाद में पता लगा भाई जिसमें दो ओ साथ में है उसमें छेद होते हैं. रिमेंबर दैट. हेमियार्थोप्लास्टी. देन व्हेन यू आर रिप्लेसिंग द एसिटेबुलम आल्सो, it is called as total hip replacement. In total hip replacement, it can be uncemented or it can be with cemented. Remember, uncemented is higher quality, longer half-life. Cemented is lower quality. Okay. If I look at the table, cemented is done for poor bone quality. Uncemented, THR, normal bone quality. Costly, longer TR. Yeah, cemented is cheaper, beta. As the contrary thought, it's cheaper. Okay. So younger people, you do uncemented. Elderly, you do cemented. So somebody asked me, sir, why will I do replacement in younger people? Longer T half, beta. ज़्यादा चलता है. Younger people, you don't do replacements for age. You do it for a disease. If the hip is gone, you have to replace it. Complications of hip replacement. Number one, infection, any joint. Number two, dislocation. Number three, mortality, like myocardial infarction, cardiorespiratory arrest, pulmonary embolism. Then you have metal associated complications, like metal ions can go cross and damage hypersensitivity. They can cause the kidney damage. They can cross the placenta and damage the fetus. Chromosomal changes. Uncemented is itself a better procedure and done for a better bone quality. Now, usually, how will they give you a history of embolism? Patient underwent THR, TKR after 48 hours. He had breathlessness. He had right-sided changes in the heart. You will go for embolic phenomena. Patient had fracture shaft of femur, had breathlessness with petechiae, fat embolism. So एक interval period होगा 24 से 48 घंटे का, 24 to 48 hours, and then these embolic class cases will be given to you. The complications of hip replacement. The questions that come to you are from embolic phenomena. Carcinogenesis under research, still not very clear. Metal related complications यही तो है बेटा सारे. 1, 2, 3, 4. Hypersensitivity, metal ion से होगा. Renal insufficiency, metal ion से हो सकती है. Damage the fetus, metal ion होगा. Chromosomal changes, metal ion होगा. Whether they lead to cancer is under research. Done? When you look at, we'll just take a break. We're about to finish in 2 minutes. When you look at the upper end femur, there's an area called the Babcock's triangle. That's an area where the monocyte macrophage system is very weak. Right? So tuberculosis can come there. But remember, TB hip, acetabulum is the commonest site. It's always the acetabulum that's the commonest site. बेटा डाउटफुल है. कुछ रिसर्च कहती है कार्सिनोजन कैंसर डेवलप हो सकता है बिकॉज ऑफ हिप रिप्लेसमेंट, कुछ कहती है नहीं हो सकता. एनिमल्स में प्रूवन है, ह्यूमन बीइंग में प्रूवन नहीं है. सो क्वेश्चन मार्क. सो स्टेजेस ऑफ टीबी हिप, right? Synovitis, synovial proliferation occurs. So there is flexion, abduction, externation, and lengthening. So TB will sit where the monocyte macrophage system is weak. Acetabulum is one area, commonest area, and Babcock's triangle is weaker reticuloendothelial system. When the fiber synovial destroys the cartilage and there is less than 1 centimeter shortening with Farder, it's early arthritis. When they say advanced arthritis or late arthritis, or they say measured shortening, that's late arthritis. So measured shortening is more than 1 centimeter. Stage 2 usually question में आता नहीं है. When the femur head is destroyed, acetabulum is destroyed, the destroyed femoral head migrates from one corner of acetabulum. It should be called as migrating or wandering femoral head, but it's a misnomer, wandering acetabulum. Similarly, if it further gets destroyed, it will look like khallar musli, pestle and mortar appearance. That's all. All these means the same thing. The head and the acetabulum are destroyed. And finally, the last stage we all know is fibrous ankylosis, because bony ankylosis seen in spine TB, all other TB will have fibrous ankylosis. All right, so this is something which you should remember. The deformity seen in stage of synovitis of tuberculosis hip is flexion, abduction, extension. Faber, stage 1. A 30-year-old male, HIV positive on antiretroviral therapy, is now having pain in the right hip. Faber is there. HIV, most common infection is TB. Go for TB. 2 months history है ना, sepsis नहीं होगा. Transient synovitis 30 year में नहीं होगा. Avascular necrosis will have decreased abduction plus internal rotation. I said whenever the hip is destroyed. Yes, stage 4. Pestle mortar is stage 4. Look at this question. Similar question अगले एग्जाम में आया था. 30-year-old HIV positive on antiretroviral therapy. He has pain in the hip joint. He has difficulty in abduction internal. TB नहीं हो सकता. Osteoarthritis नहीं हो सकता. Sepsis नहीं हो सकता. So avascular necrosis. क्यों? Because antiretroviral therapy, protease inhibitors are known to cause AVN. Okay, the same question है and you get confused. Faber TB है, limitation है abduction intonation तो avascular necrosis है. Avian is with steroids correct, but यहाँ पे steroids है नहीं mention. Whenever they talk about TB of the spine, there is loss of curvature. There is decreased joint strain. TB everywhere else, there is osteopenia because blood supply ज्यादा होगा ना, bone को कमजोर कर देगा. So tuberculosis of knee in the initial stage will have limp. Pain is the most common symptom in ortho. Limp is the second common. There will be flexion of the knee joint because in the hip there is fiber, in the knee there is flexion. You have gradual pain, chronic hota na TB, and you have synovial proliferation, synovitis. As TB knee is not treated properly, it will cause triple deformity. Remember by the mnemonic PERF. Triple means teen. Posterior subluxation of tibia, external of leg, and flexion of the knee. PERF. The causes of triple deformity, which are very, very important, the first two are TB and RA. Very nice, Dr. Neil. Excellent. Answer: localized periarticular osteopenia, osteoporosis. Next, tell me the answer. Answer is tuberculosis of knee. इसका आंसर आप बताइए. Tubercular arthritis means peripheral joints. Periarticular osteopenia. Are we good? Triple deformity is seen in RA also. All right, so let's go for a break. Before you go for a break, right? Just remember one thing, we are doing great. We have done 3 chapters. When we come back, we have to go for orthopedic oncology, extremely important and high yielding chapter. Let us start in exactly 25 minutes. That is 9:30. Thank you very much. Bye-bye. Right? Are an important topic, very, very high yield topic. So if you get a grasp of how to solve these questions, you will be able to get them correct. So they ask you usually the diagnosis of a benign lesion and the management of a malignant lesion. That's how they ask you. So the first thing that you should remember is that benign tumors are well-defined margins. So they have a territory and they have uniform consistency. So if you touch your forehead, it's hard as a bone. When you touch the tip of a nose, it's firm as a cartilage, and these lips are soft. Hard, firm, soft. So if it is a benign, if it's a tumor from the bone and it's benign, it will be throughout hard, from the cartilage throughout firm, from the soft tissue throughout soft. So benign tumors well-defined margins uniform consistency, malignant, ill-defined margins, variable consistency. So they'll be somewhere hard, somewhere firm, somewhere soft. So consistency is going to vary in different tissue because of liquefaction, because of calcification, because of softening. So this is something which you should remember. Remember one thing, clinical features are important, but biopsy is the gold standard. All tumors are differentiated on tissue diagnosis. That you should remember. All right. When you are trying to figure out, right, the age versus the part, if you see carefully, the part of the bone where the tumor occurs is always more important than the age. So in the part, we did that epiphysis, chondroblastoma more than giant cell tumor. Chondroblastoma is also supposed to be calcification. Cartilaginous tumors, they calcify. Metaphysis, we all know it's osteosarcoma. There are cysts also here. Simple bone cyst, aneurysmal bone cyst. And diaphysis, osteoid osteoma, is in the cortex. Adamantinoma and Ewing's sarcoma. So these are the affected areas that you should know of. All right. Are we good? We have done this, right, in the first section. Can I go ahead now? Thank you. Epiphysis with calcification is chondroblastoma. Also remember, upper end humerus, the proximal humerus, the name is unicameral bone cyst. Uni means single, cameral means cavity. Also called as simple bone cyst. Is more common than chondroblastoma. Remember, chondroblastoma is epiphysis, will have calcification. UBC is metaphysis. Then metaphyseal lesion, osteosarcoma. Diaphyseal, 3 vowels, osteostoma, adamantium, Ewing sarcoma. Heaven, I'll come back to you, beta. Let me just complete this area. Okay, beta? Right. Epithelial tumors. Tibia is adamantinoma. So if you look at histopathology, adamantinoma and ameloblastoma have same histopath. But in 1985, it was decided that the name of the bone will decide the name of the tumor. So the tumor of the mandible was called as ameloblastoma and tumor of the tibia was called as adamantinoma. And here we have a love triangle. Ameloblastoma's most common location is mandible, but mandible's most common tumor is squamous cell carcinoma. ये love triangle है. Ameloblastoma को mandible पसंद है, but mandible का दिल फिदा है squamous cell carcinoma पे. These are epithelial tumors, not epiphyseal. These are epithelial tumors. Remember that. Okay. So first you write this down, then we'll go to the previous slide. Previous slide. Correct. Epithelial means arising from the epithelial layer. Yeah. UBC means unicameral bone cyst, means single cavity cyst. Uni means single, cameral means camera, cavity. Also called as a simple bone cyst. We will talk about it better. The most common tumor of mandible, squamous cell carcinoma. Thank you. Many people still market ameloblastoma, right? So bone tumors have been classified by Anakin. He gave the staging, and we just spoke that part affected is more than age, but let's understand the age. First decade is a very rare age for bone tumors to occur. First decade में tumor नहीं होते, but अगर होगा तो Ewing's होगा. Second decade is plenty of tumors, and अगर होगा तो osteosarcoma होगा. And here comes the second left triangle. First decade को Ewing's पसंद है. So first decade there's no other tumor like Ewing's. But Ewing's maximum number of cases occur in the second decade. Example that, but Ewing's is not the most common tumor of second decade because osteosarcoma is in thousands and millions. So if there are 100 Ewing's, 10 will occur in first, 90 in second. Okay. So this is the second left triangle. First left triangle, ameloblastoma likes mandible, but mandible loves squamous cell carcinoma. First decade like Ewing, but Ewing's love second decade. After skeletal maturity, 20 to 40 is giant cell tumor. It's basically in the epiphysis going till the metaphysis. तो फ्यूज होने के बाद होता है. तो फाइसिस होता ही नहीं है तो क्रॉस कर जाता है. Because tumors, they respect the joint, they respect the cartilage. But fusion हो गया, can spread. After 40 years, metastasis and multiple myeloma. Done. The lesions which can involve in multiple bones. Osteochondroma. They are developmental abnormalities. Fibrous dysplasia. Again, developmental abnormalities. N chondromas. Giant cell tumor. Ewing's sarcoma. They are the tumors which go from one bone, multiple bones. Okay, Balwant, I'll go slow. Yeah, developmental abnormality means they are not malignancies, they are just developmental malformations, aberrations. Radioresistant bone tumor, osteosarcoma. I just want you to remember one name. That's enough for you. When you treat a bone tumor, remember we are a surgical branch and we are going to do surgeries to the tumors. And in benign tumors, it's radio and chemo don't have a role, right? So we want to go for surgical approaches. Number one, if it's a cavity, open the cavity and curate it out. That's called as dry mopping or jharu lagana. If the cavity has an aggressive lesion going and embedding in the bone, apply some chemical like at home when we do jharu, we do pocha, wet mopping. Here you do phenol. So we are doctors, we will not put phenyl, we will put phenol because it's called as extended curettage. Right? But then these are for the cavities. If there are solid tumors, you will have to do surgical approach. You can take out the tumor inside intracapsular through the margins of the pseudocapsule, marginal excision. The most common type with 3 centimeter margin, wide local excision. And then the whole compartment, radical excision. So these are the different varieties of excisions that you have. Most common is wide local excision. When I treat bone tumors, I remember that the benign tumors are only operated. All benign tumors. Cartilaginous tumors only operated, whether it's benign or malignant, doesn't make a difference because cartilaginous tumors are chemo and radio resistant. Most common surgery overall is wide local excision with 3 centimeter margin. If it's a cystic lesion, you will do a curettage like unicameral bone cyst, simple bone cyst. When it's aggressive, chemicals are used to kill the cells, called as extended curettage. For example, you can use phenol, which is most common chemical. Liquid nitrogen is most efficient. It's the best. It is used for aneurysmal bone cyst, chondroblastoma, giant cell tumor, and chondroma. And malignant lesions, given chemotherapy before surgery, followed by surgery, followed by adjuvant chemotherapy. So you give chemotherapy, shrink the size, shrink the vessel, decrease the spread, remove it with 3 centimeter margin, give for the residual cells A for after, A for adjuvant chemotherapy. And as you people were discussing, the most radiosensitive bone tumor known to man is Ewing's. It melts like snow with radiotherapy. '94. We are on page number 95 right now. AC after surgery is adjuvant chemotherapy. Adjuvant chemotherapy afterwards. Okay. So we will talk about whether Ewing's is treated by radiotherapy or not. I'm leaving it as a question mark whether Ewing's is treated by radiotherapy or not. Okay. So you wanted to see this? This is done. Done. This is done. Next. Let's do, we will talk about what is best for osteosarcoma. We'll come to it. So if you have unicameral bone cyst, unicameral bone cyst, it's a single cavity filled with fluid seen in upper end humerus. So single central cavity. So when there is a break of a cortex in it, with the movement of the fluid, the cortex moves up and down, called as trapdoor sign. ऐसे हिलता है टक टक, जैसे अमिताभ बच्चन एक मूवी में आते थे ना अपने पुलिस चौकी में, और दरवाजे को धक्का मारते थे, ठक 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 हिलता था. That's how the movement of the segment hills. That's trapdoor sign. And then this falls to the bottom, called as a fallen leaf sign. It can only fall to the bottom when it's a single cavity. अगर कैविटी में सेप्टे हैं तो इट विल बी हैंगिंग, इट कांट फॉल. सो फॉलन लीफ साइन सिंगल कैविटी में होगा, फ्लूइड होगा तभी नीचे जाएगा. राइट. ट्रीटमेंट फॉर दिस कंडीशन इज curettage and bone graft. That's your nibbler, that's your curate. You can also do an aspiration and put steroids, which will have fibrotic effect. The fragment, the cortex falls, beta. Arish, a small bony fragment which has broken from the wall, pathological fracture hota hai, it falls. And then you can put aspiration and the sclerosis for it to become strong. Okay. Sometimes you don't have to do anything. You leave it, observe it. So this is about unicameral bone cyst. Steroid again causes fibrosis and it resolves on it. Aneurysmal bone cyst is upper end tibia. You can see one cortex is okay, the other is involved. So multiloculated eccentric. Instruments here bete. This is a nibbler. This is a curate. So multiloculated eccentric, upper end tibia. Second decade of life. Before maturity, you can see growth plate hai. Before skeletal. What age will knee joint ossify? 18. So age group हो गया 11 to 18 years because second decade है ना. ठीक है. On MRI, fluid levels are seen. Treatment, extended curettage. Done. Codman's tumor is another name for chondroblastoma. It's epiphyseal calcification. Treatment is extended curettage. On biopsy, they have chicken wire calcification. ये मिलता है आपको in biopsy. Chicken wire calcification on biopsy. Codman's tumor, cartilaginous tumor. It's not Codman's triangle. Codman's triangle is a periosteal reaction. This is the name, Codman's tumor. So, you know, फाइब्रस कॉर्टिकल डिफेक्ट मतलब कॉर्टेक्स के अंदर एक फाइब्रोइड टिश्यू और नॉन ऑसिफाइंग फाइब्रोमा, दे मीन द सेम. दे आर द मोस्ट कॉमन बिनाइन लीजन ऑफ द बोन. ये मिल जाएंगे आपको बोन के अंदर. दे आर नॉट प्री मेलिग्नेंट, सो दे आर नॉट हार्मफुल. दे विल बी सीन इन फर्स्ट डिकेड एंड अपने आप गायब हो जाएंगे. मेटाफाइजल लीजन्स. ओके, सो द मोस्ट कॉमन बिनाइन लीजन इज fibrous cortical defect or non-ossifying fibroma seen in the first decade of life. आपको पता है बहुत सारे एमसीक्यूज में दिस इज एन ऑप्शन but not an answer till now. It can come to you as an answer. The most common benign lesion of the bone. Remember that. Non-ossifying fibroma बहुत कॉमन होता है ये. सुन रहे हैं मेरी बात? So this is something which is very very valuable for you to understand. Next. Osteo means bone, chondroma means cartilage. Bony growth. ये देखो bony growth with a cartilage cap. अब मजा आएगा. When you will touch it, you will touch the bone and you will touch the cartilage. When you will click an X-ray, only the bone will be seen. So large to feel, small on X-rays. Again, I told you, it's not a tumor, it's a developmental abnormality. And because you will feel the tip, it goes away from the joint, beta. It goes away from the joint. It grows away from joint. It grows till skeletal maturity. It will keep on growing. बड़ा होते जाएगा. देख बेटा, when we touch it ना, when we touch this lesion, हमें bone भी feel होगी और cartilage भी feel होगा. Osteochondroma, bony growth with cartilage cap. एक्सरे कराओगे तो सिर्फ हड्डी दिखेगी, cartilage दिखेगा नहीं because cartilage is reducent. Large to feel, small on X-ray. Okay, now it grows away from the joint, grows till skeletal maturity. Well differentiated होता है ये. मतलब इसका लीजन का कॉर्टेक्स और मैरो बोन के कॉर्टेक्स और मैरो से मिला होता है, अलग नहीं होता. ऑलराइट. इसके अंदर एक क्लासिकल चीज होती है, पेन. और क्वेश्चन यही आता है, व्हेन इज इट पेनफुल? इसकी कॉज ऑफ पेन क्या है? बर्साइटिस. ओवरलाइंग बर्सा का इन्फ्लेमेशन इसका सबसे कॉमन कॉज ऑफ पेन है. इट कैन अंडरगो मेलिग्नेंट ट्रांसफॉर्मेशन. इसमें क्या होता है, सिंगल लीजन होगा ना, सॉलिटरी, सो लेस देन 1% मेलिग्नेंट चला जाएगा. मल्टीपल होगा 6%. इसके अंदर जो मेलिग्नेंसी आती है उसका नाम है कॉन्ड्रोसार्कोमा. कैसे पता लगेगा कॉन्ड्रोसार्कोमा आ रहा है? कार्टेज थिकनेस बढ़ गई, या फिर ज्यादा जल्दी ग्रो करने लगा, या स्केलेटल मेच्योरिटी में रुक जाना चाहिए था ना, उसके बाद भी चलने लगा. इट केप्ट ऑन ग्रोइंग आफ्टर स्केलेटल मेच्योरिटी. All right, and there is a loss of differentiation. Normally, the cortex of the bone, the cortex of the lesion are continuous with the marrow, and the marrow is continuous. But here, there is a block. The differentiation is gone. All right. So cartilage thickness more than 2 centimeter, rapid growth, growth after maturity, loss of differentiation. Treatment. What is the treatment, Aishwarya? Look beta. Here, the cortex of the tumor is continuous with the cortex of the bone, and so is the marrow. So it is differentiated, benign lesion. All right. So normally well differentiated. If the differentiation gone, malignant ho gaya na. That's what I'm saying, Nirali. If the differentiation is gone, it indicates it's a malignant transformation. Okay. What's the surgery? Anybody? Removal along with periosteum. We had done that. It comes from the cambium layer. It comes from the cambium layer. So removal along with periosteum. Osteoid osteoma. It has a nidus in the cortex. Nidus means beach, which means lytic lesion surrounded by sclerosis. So दोनों lesion होंगे इसके अंदर. Osteoblastic, osteolytic cells are seen. It is seen in the cortex. That is why CT scan is very useful in this condition. Night pain relieved on taking salicylates या फिर aspirin. Diaphyseal lesion, right? So this is a tumor of the thick dense bones, osteoid tumor, not pre-malignant. Night pain relieved on taking salicylates or aspirin. कई बार तो aspirin से disappear हो जाता है. It's a tumor in the cortex, so you'll do a CT scan. All right. Treatment is burn it, finish it. Radio frequency ablation. Single central cavity, upper and humerus with fallen leaf sign, unicameral bone cyst. Multiloculated eccentric, upper and tibia, fluid level on MRI, aneurysmal bone cyst. Large to feel, small on X-rays, bony growth with a cartilage cap, osteochondroma. Night pain relieved on taking salicylates. In the cortex of the bone, lytic lesion surrounded by sclerosis, osteoid osteoma. Epiphysis with calcification of the upper and humerus is chondroblastoma. Aspirin se disappear because it inhibits the markers in this. Osteoid osteoma का एक variant है incidental discovery of dense dots in the bone, ivory osteoma, seen in the skull. Ivory means white, compact is thick white, ebon it is shining white. It is seen on the skull and requires no treatment. It's seen on the skull and requires no treatment. Ivory osteoma, white colored, dot dot. Enchondroma is the most common tumor of bones of hand or feet. Most common tumor of bones of hand and feet. On biopsy, hyaline cartilage is seen. Treatment is extended curettage. 5% cases are pre-malignant. बायोप्सी पे हाइलिन कार्टिलेज दिखता है जनीशा. Yes, if required, grafting is done. Whenever you're doing extended curettage, grafting is a part of it. When you have two syndromes with it, one is only enchondromas, multiple enchondromas. It's called as Olliers. 30% cases pre-malignant. Mafusi is many things, means enchondromas, hemangiomas, and phlebolith. What is phlebolith? Calcified superficial veins. So this is what is hemangiomas, multiple enchondromas, and phleboliths. M for Mafusi, M for many things. And this is 100% pre-malignant. So Olliers is 30%, Mafusi is 100% pre-malignant. Done? What's the answer to this question? Sorry, we missed out one question in the center. Answer to this question, please. Boom. बोन वर्ड नहीं है बेटे. बूम हो गया. बूम बूम बूम. उड़ गए. जब तक आप एमसीक्यूज प्रैक्टिस नहीं करेंगे तो बूम बूम होगा. चलो. एनकॉन्ड्रोमा बेटा मोस्ट कॉमन ट्यूमर ऑफ हैंड पूछा है ना, वो तो बोन का होता है ना. 90% से ज्यादा ट्यूमर जो होते हैं, मोस्ट ऑफ मोर देन 90% ऑफ ट्यूमर्स of the hand are squamous cell carcinomas. Okay? And chondroma is a very small migrant. It's some of the bones of hand and feet. Chondromas is cartilaginous calcified tissues. So you have in chondromas O-ring sign. So they are towards the end of a bone. Popcorn calcification is seen. All right. So enchondroma is inside the medullary cavity. Chondromas is towards the end of the bones. Upper and tibia, when you see, right, the aneurysmal bone cyst is metaphysis plus before maturity. Whereas GCT is epimetaphysal. So it is not purely epiphyseal. It is after maturity. It is after maturity. Done? Correct. When I talk about giant cell tumor, it has two types of cells. The mononuclear cells are the malignant cells plus the giant cells. It is seen in the age group 20 to 40. More common in females. giant till joint. It can go till the joint. Soap, bubble appearance. It is so thin that the cortex can bake. Egg, shell, crackling. 3% cases can have mets to lungs. Right? So it can go till the joint. Tumor of lower end radius is GCT TPO till proved otherwise. You can see it's going till the end. Till proved otherwise. Next. Going upper end tibia till the end. Upper end femur till the end. Within 1.5 centimeter of joint. So lower end radius, upper end tibia, upper end fibula, bus, upper end femur. But this is the most common site. And the last love triangle. फर्स्ट लव ट्राइंगल एमेलोब्लास्टोमा को मैंडिबल पसंद है, मैंडिबल को एससीसी. सेकेंड लव ट्राइंगल फर्स्ट डिकेड को इविंग्स पसंद है, बट इविंग्स लव्स सेकेंड डिकेड. थर्ड लोअर एंड रेडियस लव्स जीसीटी, बट जीटी लव्स लोअर एंड फीमा. व्हेन यू हैव दिस इज द जीसीटी. Again, a giant cell tumor. Remember, fourth option is osteoclastoma, but GCT is a better answer. Again, which is the correct? So epiphyseal is correct. It doesn't have ground glass. It is so bubble. It is 3%. Radiotherapy is not given. Extended curettage is done. Treatment. What is the diagnosis? Giant cell tumor. GCT, osteoclastoma, there is no difference. If you mark both, you will get equal marks. Osteoclastoma, because GCT is not there in those options. Next. Chemotherapy is not the mainstay. Next. Correct. 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 All five are correct. Tumors that have giant cells are called as giant cell variants. Number one, fibrous cortical defect or non-ossifying fibroma. Can see giant cells, not a variant, not a tumor. Fibrous dysplasia can have giant cells. ABC and UBC can have giant cells. Chondroblastoma, chondromyxoid fibroma can have giant cells. Osteogenic tumors can have giant cells and brown tumor can have giant cells. All of them will have mononuclear cells and giant cells. Only GCT on histopath, the nuclei of both the cells are identical. So stromal cells stroma से बनते हैं, right? वहां से आता है giant cell tumor का malignant component. वो जब fuse करते हैं, when they fuse, they make a giant cell, but when it becomes a giant cell, it's not a malignant component. But the nucleus stays the same. That's why the nuclei of both the cells are identical under the microscope. How do you differentiate giant cell tumor from its variants? Histopath. You don't differentiate tumors by any other way. All right. Next. A 15-year-old presented painful swelling over left shoulder. X-ray shows an osteolytic area with calcification over the epiphysis. So epiphysis with calcification. Chondroblastoma. I said that if these are the mononuclear cells of GCT, and their nucleus is like this, single star shaped. And if this is a giant cell, so GCT will have identical nucleus of both the types of cells. This is what I said. Osteoblastoma, epiphysis with calcification is chondroblastoma. Next. The upper and femur looks like a stick a shepherd holds is fibrous dysplasia. On X-rays, the bone appears like a ground glass pattern. So ground glass appearance of the bone. Sometimes the upper and femur will have a sclerotic band called as a Rind sign. Answer. Shepherd-Crook deformity. Next. Most common type of fibrous is monostotic. Where? In femur. More than 75% cases. Done. Fibrous dysplasia has a syndrome. Everything starts with hormonal imbalances and also has pigmentation in it. So pigmentation, that is coffee color spots, multiple bones involved, polyostotic fibrous dysplasia, precocious puberty. So these are the three P's. Shepherd crook is a stick that a shepherd uses to, you know, move around. That's how the fibrous dysplasia looks like at upper and femur. Okay, it looks like irregular crooked stick of a shepherd. Answer. Rind sign is also fibrous dysplasia, beta. Done. When the histiocytes they proliferate, they can destroy many things. For example, when they destroy the whole human being, fatal is Letter-Sway disease. When it destroys three areas, the skull, the eyes, and the bone, Hand-Schüller-Christian disease. So skull, the eyes, and the hormone system, diabetes insipidus. So histiocytes, when they proliferate in the bone, so they are known to damage some areas. When they are aggressively destroying the whole human being, that's Letter-Sway disease. When they destroy limited areas like a skull bone, like the eyes, right? And the hormonal changes, that's Hand-Schüller-Christian disease. Okay, beta, I'll just tell you why I changed these slides. We'll go slow. I have changed slides in these questions, and the reason is very simple. All of them are the same. But we will take 2 minutes and then we can go. I am in no hurry, beta. The moment I get thumbs from you, then I will move. Okay? I don't mind spending through 3 minutes because there is a question that's going to come from this area. Chondro is calcified beta. Giant cell tumor is lytic lesion going till the end of a. First love triangle is ameloblastoma likes mandible, mandible loves squamous cell carcinoma. Second love triangle is first decade like Ewing's, Ewing's loves second decade. Third love triangle is lower end radius lytic lesion going till the end of a bone is GCT. But GCT most common location is lower end femur. So that's how the stick looks like, the crooked sticks. The bone has a hazy appearance called as the ground glass appearance in fibrous dysplasia because the bony tissue is replaced by a fibrous tissue. And then at the upper end, it looks like a shepherd crook, right? The most common type of fibrous dysplasia is when single bone is involved. Although fibrous dysplasia can involve multiple bones, but the single bone involvement of femur is the most common type. So this is the sclerotic margin at the upper end femur. Rin sign seen in fibrous dysplasia. The syndrome is McAcune-Albright syndrome with polyostotic means multiple bones fibrous dysplasia with precocious puberty and pigmentation. स्पीड ठीक हो गई एमएलबी साहब 180 से 80 पे आ गया मैं एक बार चेक कर लो बेटा कितना चल रहा है ओडोमीटर चलो ठीक है दिस इज अगेन मैकएक्यून-एल्ब्रेट सिंड्रोम मैं भी मानता हूँ 180 बेटर थी पर देखो मालिक जो कहेगा मालिक कहेगा तो कहेगा मालिक की तरह जाएंगे So histiocytes, they are known to destroy a human being, let us see disease. They can destroy the skull, the eyes, and the hormone system, Hanschel Christian. And right, and when a single area is destroyed, that's called as eosinophilic granuloma. So eosinophilic granuloma, solitary bone or lung lesion. Skull is the most common site. And पता है क्या होता है the margins of the lesions are sloping called as beveled lesion. ये इसका एक बहुत key point है, very key point here it is. Biopsy, you have cells which have got granules. The granules are tenisecate appearance. And remember, histiocytic proliferation destroying single area like skull bones, it's self-resolving, goes away. And whatever is self-resolving in my subject is an MCQ. Anything that gets okay on its own is a question. So spontaneous resolution occurs. Right? So this was about the Langerhans cell histiocytosis. Hemangioma, more of an image-based question. These are very common lesions. So you have vertical striations on the vertebra, just like your denim has vertical strips called your appearance. This is one. There is jail bar pattern or jail bar appearance. Behind the jail, there is multiple vertical striations. You know, when you get these corridor appearances or jail bar pattern and you do their CT scan, there appears to be unequal sized dots called as polka dot sign. It's a CT scan finding. Polka is a pattern on the cloth, unequal sized dots. Right? So usually hemangiomas don't need anything. Don't touch it. Leave it. Chordoma. chordoma. This tumor arises from the notochordal remnants. It is on extremes of spine. It's at the top and the bottom. It is the most common malignancy of spine after multiple myeloma, seen in sacrum. Cells are seen. Treatment is surgery plus minus radiotherapy. So they have vacuolated cytoplasm, the physalis. All right. So it's extreme at the base of the skull or at the lower part. Sacrum is the most common location for chordoma. It's not chondroma. Chondromas were O-ring sign. N chondroma was hyaline cartilage in the medullary cavity, all ears and Maffusi's ka part. Chordoma is from the notochordal remnants. Chordomas are not common, so is the synovial sarcoma. But then the questions come. It's a misnomer because it does not rise from synovium, but it looks like synovium, so it's synovium. So it's a misnomer because on biopsy, it doesn't look like synovial sarcoma. It is not synovium, but it does resemble, so called as synovial sarcoma. So the origin is not synovial cells. It has a translocation between chromosome X and 18, causing a fumous joint called as SYT-SSX. That's a fusion gene. It is seen near the joints, the bursa. So that's the origin. Synovium is not the origin. The bursa are the origin. Right? Synovial sarcoma is a biphasic tumor. If a tumor is malignant, like GCT has the mononuclear cells is malignant. Osteosarcoma has the osteoid cell. Here, it's a biphasic tumor. Epithelial भी होगा, mesenchymal भी होगा. So there are two cells of malignant components, which is a rare thing to happen. So it's a biphasic tumor. Treatment is surgical, not to confuse anybody or harm anybody. It's surgical treatment. So it's a biphasic tumor with epithelial and mesenchymal component. That's all. Pulsatile bone tumor is osteosarcoma. We are on page number 98. Pulsatile bone tumor is osteosarcoma. Now, this is where the people were talking to me. They were asking me, sir, which is the radiation-induced sarcoma? So, osteosarcoma is a radiation-induced sarcoma. Cancer of youth occurs in the second decade of life. Again, lower and femur. It's a radio-resistant bone tumor. So, radiotherapy does not work here. So, in fact, you gave radiotherapy for some other reason, but after 10 to 15 years, and that area, a malignancy comes. You diagnose, this comes out to be osteosarcoma. It's bone forming tumor. So on the slides, pink dikhega. It's an osteoid or a bone forming tumor. This one you want, beta? Ajit, you want this one? It's a bone forming tumor. It is associated with germline retinoblastomas. Done? Can you name the tumor? Can you name the tumor which has got night pain? चेतन साहब, ऑस्टियोमा नहीं है बेटा. द ट्यूमर विथ पेन इज ऑस्टियोसार्कोमा. नाइट पेन is also osteosarcoma. Night pain relieved on taking salicylates is osteoarostoma. Salicylates to mention nahi hai, so you can't assume it to be there. Okay? Osteosarcoma can come from the medullary cavity. Periosteum, separate from the periosteum, parosteal. In a patient who had Paget's, where you have more turnover of the bone, more formation, more resorption, or radiotherapy induced sarcoma, that is after 10 to 15 years, poor prognosis. So these two are poorest prognosis. Pagetoid and radiation induced has poor prognosis. The parosteal has the best prognosis. Okay. Osteosarcoma, they have malignant cells, right? Because of osteoid. And they lead to homogeneous calcification. All right. By calcifications. Homogeneous, uniform. Chondrosarcomas have patchy calcification, patterns of calcification. Done? ये बोन है बेटा, लोअर एंड फीमर है. ओके. ये पेरियोस्टियम है. If it is from the medullary cavity, it's classical. If it is along the periosteum, it is periosteal. It comes on the posterior elements out. That's called as parosteal. So parosteal is besides the bone. You can call this as parosteal. It has a very good prognosis, right? Again, parosteal. Methotrexate is a very important agent. So you give neoadjuvant chemotherapy followed by surgery, followed by adjuvant chemotherapy. Methotrexate is a very good drug. Etoposide is not used. Both are MCQs. Okay, done. Prognosis. The extent of a disease is a poor prognosis. Staging. The higher the stage, the worse the prognosis. Pulmonary Mets. They are the most common site of Mets. In fact, they can sometimes cause pneumothorax also. Poor prognosis. Systemic Mets. Even poorer as compared to pulmonary. Grade, again poor. So what I want to say is if you have a liver mets, it will have poorer prognosis as compared to lung mets. लंग भी पुअर है बट लिवर उससे भी पुअर है. ग्रेडिंग को कलर क्यों किया हुआ है? व्हाई हैव वी कलर ग्रेडिंग? वी विल टॉक अबाउट इट. ओके, वी विल टॉक अबाउट इट.
एक मिनट.
टेल मी द आंसर.
अगर
NEET 2024. Osteosarcoma, because it's in the metaphysis and sundry appearance. Done. Again, histopathological segment. Answer. Osteosarcoma. Nice. Next. Ewing's is like a marrow malignancy. It's spreading throughout the body. So that's why it is a tumor from the marrow. So marrow biopsy is useful. Seen in second decade more than the first. Second decade more than the first. Seen in the femur diaphysis. Pain is a universal complaint. Osteosarcoma, pain. Ewing's, pain. Osteosarcoma, lower end femur. Ewing's, femur diaphysis. It presents like osteomyelitis. Both Ewing's and osteo, they present like osteomyelitis. Presence like infection. So be careful. Hazy thickened cortex. It's a round cell tumor with glycogen positive cells. Blue colored histopath दिखता है, blue, round blue cell tumors. Translocation 1122 commonest है. The bigger digit is always secondary. 21, 22, 7, 22. Okay. Trisomy 8 and trisomy 12 are the specific things. MIC2 is a specific marker. मुझे लोग पूछ रहे हैं क्लास कब तक है. मुझे पता है कि खत्म होने वाली है, तो मुझे अच्छा लग रहा है. Ortho beta is one of the most difficult subject. Remember that. And those who have been able to pull through now, you are phenomenal. Clap for yourself. तुमने फोड़ रखा है. बिल्कुल. और क्या. आप अपने आप देखेंगे पीपल हटते जाएंगे. दे विल कीप ऑन मूविंग एंड दोज हु स्टिक दे क्लियर. यू नो, चक द इंडिया, that phase that Shahrukh Khan says to the captain, stay. That's the key of the game. Stay. हो जाएगा. आई एम ऑलवेज हैप्पी. यार मैं दुखी क्यों हूं भाई? दुखी क्यों होना है? जिंदगी का तो पता नहीं, कुछ तो खुश तो रह सकते हैं. कर लोगे. क्वेश्चन आंसर हो जाएंगे अगर तुमने ध्यान से सुन लिया तो. देखना यार, करना है क्या हुआ. All right. So Ewing's is a tumor of marrow. Second decade more than first. Femur. Pain is a complaint. Presence like osteomyelitis. चलें आगे. Can I move ahead, please? Presence like infection. Onion peel appearance. Soft tissue component. क्लास जिम्मेदारी का गेम है मोहन. Each line is very, very precious for you guys. Ewing's is a round cell tumor with glycogen positive cells. The translocations are 1122, 2122, and 722. Trisomy 8 and 12 are there. And MIC2 is a specific marker. Poor prognostic factors for Ewings. Blue होगा, blue, round blue cell. Pink is osteoid, blue is Ewings. Age more than 12. More male is poorer. The proximal lesions are poor. Fever. So Ewings present like osteomyelitis. When it is fever, it's already poor. Low hemoglobin, poor. Increased TLC, poor. Metastasis, chemoresistance, and relapse, poor. So metastasis, poor. Chemoresistance. So Ewings is radiosensitive tumor. But chemoresistance is a poor prognosis. समझ रहे हैं आप? विनोद सुन रहे हो तुम? सुनने वाली बात क्या है? The most important बात you need to understand here is that chemotherapy has a significance in the treatment. And that is why, remember, Ewings can never be low grade. It means game over. All Ewings are high grade malignancies. They're finished. And that's why if you look at this, high counts, increased TLC, high ESR, fever. If somebody has all this, it already means the poor prognosis. Controversial? No. These are short, worst prognostic factors. People don't give it to you. Why grading was in red color in osteosarcoma? Because Ewing में grading होती नहीं है. It's always high. It's only in osteo you do grading. So Ewing is never graded. It's already high. Treatment for Ewings. Preoperative chemotherapy. Followed by surgery, followed by adjuvant chemotherapy. So radiotherapy may be given. It's plus minus. Hazy cortex. Ewing sarcoma. So what I mean to say is chemoresistance in Ewings is a poor prognostic factor. AC means adjuvant chemotherapy. Because radiosensitivity does not cure the spreads, the micromets and metastasis, which chemotherapy can do, because it's a very aggressive tumor. Which type of translocation seen in diaphyseal tumor with small blue round cells? 11, 22. Next. Somebody asked the question. So blue, Ewings, round blue cell tumor. Next. Trisomy 8, okay? Because it's 11, 22. It's not 22, 11. Next. Ewings, diaphyseal, okay? So sundry appearance is there, but even then it's Ewings because it's diaphyseal. Words. So यहाँ पे, look here, the part affected is diaphysis. Looks like sundry, but even then Ewings is chosen, osteo is not chosen. And presentation also is more like infection. And when it's infection, think about Ewings more than osteosarcoma. Everything is possible, but most likely such aggressive lesions are Ewing's. 8-year-old male, pain and swelling upper and tibia. Local temperature is raised. Margins are irregular. Variable consistency. Answer. बूम हो गया बूम. Osteosarcoma. अपर है बेटा. Upper means either epiphysis or metaphysis. Age goes towards Ewing's, but part goes towards osteosarcoma. This is based on the rule. Part is more important than age. Done. MYC2 positive cells are seen in Ewing sarcoma. Good. Next. Chondrosarcoma, that is cartilaginous tumors. They are usually seen in the pelvis. They are calcified. They have a paraneoplastic syndrome. Where the sugar levels are very high. Hyperglycemia is there. Amongst the malignant tumors, they have the best prognosis. They are treated by only surgery. Best prognosis among the malignant tumors. So, patterns of calcification. Multiple myeloma will always have very high ESR. They have high calcium. Multiple bone pains. Multiple myeloma is a tumor of plasma cells. They only have lytic lesions. Criteria. They have serum or urine M proteins. They have bone marrow plasma cells or single solitary lesion of plasma cells called as plasmacytomas. They can have lysis of the skull, low hemoglobin, high calcium, damaged kidney, hyperviscosity causing amyloidosis, bacterial infections. On skull, you have punched out lytic lesions. And in plasma cell leukemias, it's more than 20% cells in the smear. So these are classical X-rays of punched out lytic lesions of multiple myeloma. You must not make a mistake. I have given these to you on page number 99. Don't make a mistake. This is something which is very precious. Punch out lytic lesions on the skull. ... Right? They can be femur, humerus, ribs, vertebra, skull, anywhere. Again, a lytic lesion of skull, resembled by the mnemonic Melthorme. Classical causes of lytic lesion of skull, like M is metastasis. E is eosinophilic granuloma, which has a lytic lesion which is sloping, called as beveled edges. Langerhans cell histiocytosis will have big lesions called as permeative. Tuberculosis, hyperparathyroidism. It usually has salt pepper skull. You see it and you feel as if there's a classical thing, but ... will be seen in hyperparathyroidism. Osteomyelitis, radiotherapy, multiple myeloma, and epidermoids. These are the causes of Melthorme. So punched out lesions of multiple myeloma, ... Beveled lesion of eosinophilic Granuloma. Somebody is asking in the box, but it's easy. Eosinophilic granuloma. Welcome to the class. When you have large permeative lesions. Large permeative lesions. Langerhans cell histiocytosis. Any variety. Salt, pepper skull. Hyper PTH. Right? So these are important. This is beveled, sloping. These are big, big gaddas, permeative. These are sprinkled salt pepper. This is cotton wool. Now the lytic are over. Some more skulls to complete the region. Cotton wool. Seen in? Very good. Pagettes. This is salt pepper skull. Sprinkled. Cotton wool skull. As if the skull size is increasing. Large osteoporotic area in pagettes called as osteoporosis circumscripta. Again, pagettes. Hair on end appearance, thalassemia. This is a lytic lesion, all right? Question number 1. Single lytic lesion in a mid-shaft tibia. Grooved nucleus. बेटे जो grooved nucleus है ना, ये histiocytes की पहचान होती है. What is the likely diagnosis? Langerhans cell histiocytosis. Question number 2. Patient with tibial trauma, define the reason. So now this question, they say that multiple X-rays were given and there were lytic lesions all over. So answer is metastasis in this case. If multiple were given. Some people said they saw wandering acetabulum like, so I really doubt that can happen. Which of the following tumors with their treatment choice? Man. So you have osteosarcoma. So let's say osteoid osteoma. Frequency ablation. Simple bone cyst. Steroids. GCT, curettage. Osteosarcoma, wide excision. Middle-aged patients with back pain on bones can osteoid lesions in which of the following can be possibility. Renal cell carcinoma, because prostate, carcinoid, and medulloblastoma, PCM, have always been coming, and this is what they are white metastasis. So renal cell will have lytic mets. Which metabolic condition has phosphaturia and osteomalacia? So fibrogenic tumors can cause bone weakening disorders. Last slide. Purely osteoblastic mets are in prostate, carcinoid, and medulloblastoma. Breast is not purely osteoblastic. Which condition has bone softening disorders? Fibrogenic tumors. Fibrosarcoma. 10-year-old child presented with mid-tibial swelling, which on X-ray revealed a lytic lesion with sclerotic miasm. What is the most likely diagnosis? So osteoid osteoma. Next. So that's where we stop. All right. So tomorrow we will start a little early. Okay. We'll start at 4 o'clock. So let's talk for 5 minutes before we go. All right. We will go after 5 minutes. Okay. And we will start at 4 p.m. tomorrow. PACM has only osteoblastic lesions. True. Strange. Read and come whatever we have done today. It's a request that do the questions as well. You will get most of them correct. It is important to exponentially revise orthopedics, which is an important subject. We will start with one of the most beautiful topics tomorrow, the nerve injuries. Right? It's a short subject, short topic, but you always get questions from it. What it takes to clear entrance exam. This is what I wanted to discuss with you guys. So when we talk about what it takes to clear entrance exams in life, remember a very beautiful thing which I want to tell you. When I was preparing for entrance, one of my senior asked me who taught JIPMER, what is an inch? So an inch is 2.5 centimeters. That's an inch. All right, that's an inch. So I went and I told him that inch is 2.5 centimeter, and he tell me, asked me go and read again. But I was very confident about values. So I told him atto, femto, pico, nano, micro, milli, centideci. Atto, raised to minus 18, right? Femto, 10 to the minus 15, pico, 10 to the minus 12. I kept him telling all the value, but he said, what is an inch? So he kept on asking me, what is an inch? I said, okay. But he was JIPMER rank 1 and I had just started my 11th standard. But he was brilliant and he guided me how to study. So I followed whatever he said. And finally, I cleared the Delhi exam. I got through into MAMC. And before this all could happen, my dad told me, why don't you write AIMS? And I went and wrote AIMS. And in AIMS, I got this question, what's an inch? And I did not go and look back in the book at that time, 2 years back, when he asked me to have a look at what's an inch. And this question never came in any exam. And neither atto, femto, pico, nano, micro, milli, centideci came. And there were options in the exam were 2.5, 2, 2.53, 2.54, 2.55. And I always used to say first and fourth, तो होगा नहीं, दो मार दिया मैंने. In MCQs, first and fourth is usually not an answer when the numbers of scientists or names are involved. And when I came out, my mom was waiting. I said, Mom, if I get this question correct, I might qualify for AIMS. I reached home, I rushed, requested my mother to take me by auto, but that privilege we didn't have. And when I went and saw inside, the answer was 2.54, and I was waiting number 1. And I was waiting number 1 in AIMS, and the way to my hospital from my home, AIMS was always seen on my right every day, and I used to miss a beat. What it takes. It takes the courage to ignore atto, femto, pico, nano, micro, milli, centideci and go from 2.5 to 2.54. That's what it takes. Thank you very much. Good night. Bye-bye. See you at 4 p.m. tomorrow. Thank you.